Awesome, awesome, awesome. Hello, hello, hello. Just getting things situated here. Give me 1 second, everyone. Mm-mm-mm-mm-mm-mm. And there we are. Okay, camera's on. We are recording, and we are live on Facebook. Hey, Miss Genevieve Banks Giles, how you doing? How
Hey,
you doing?
hey,
What's
Jenny.
going on? I know you're muted, but that's all
And
good.
then pop in there.
It's all good. All right, we're going to get ourselves
Oh, there you
started. So,
go.
welcome, everybody. Welcome to Awareness Wednesday Prime Time. We are your hosts, Reggie and Victoria Flanagan out of New Jersey. So, welcome, everybody. It's connected anyway. Our co host, thank you for being here. We appreciate you guys taking the time out of your schedule to be on this prime time event. Well, I can tell you it's going to be a great one. This report Victoria does in the morning, and it was an awesome report this morning, and there's going to be another one this afternoon or this evening on our prime time for those who missed it and get a chance to see it and hear it. But more importantly, the topic of discussion is serious. It really is. When you hear these numbers that she's going to throw at you, it's going to blow your mind. So before we get into our topic of discussion, let me pass this over to Victoria, our certified health coach, the urgent, the one that does the homework, the detailed information, that does all that for all of us. Give her reasons why this platform is important to her. Victoria, take it away.
Okay, thank you, thank you, thank you. Now that's what's showing up on the page.
On, I don't have that.
This is what you going live. This is on my Facebook
I
page.
have no control over that, dear. That's not me. You might want to speak because you're live.
Oh, okay. I'm just saying, if we live, this is what they're seeing from the computer.
I don't
You got
know.
to get that off of there. All right, hi family. Yes, yes, yes. I am here. I am here. This was it was ask and you shall receive. Here we are. Here we are.
Keep talking. Let me just take a little
Okay,
research
this
here.
is it. We were getting set up for later and something else popped up there. See, that's there.
Let's just take it down.
Okay, there we have it.
Let's see if that helps
We
you.
got 9,000 things going on over here because
Let's see if that helps.
I'm doing something later as well.
Indeed. Let's see if that helps.
We'll be
So,
talking about diabetes later. Okay, there we go.
all right. So it's
All
off.
right,
Now let me go back into my screen share. Give me a second, family.
because that'll mess me up some kind of bad, y'all. You have no idea. That going on, this going on all over the place.
All right. So we're good to go. Now you're good.
Yes, we are good. We
All
are
right. So you should see
good.
the banner in three, two, one. Bam. There you
Okay,
go.
there
All
we
right.
are.
There we
There's the
go.
banner.
Congratulations. You passed the test.
Okay, there we have it. There we have it. Yes, our topic today is going to be syphilis.
And not in,
The numbers are on the rise,
yes,
family. They're on the rise,
yes,
and
they
it's
are.
alarming. It truly is alarming. This was an eye opener for me. I do a lot of topics, but this one here had me sitting on the edge of my chair. So it's something that's out there. It's been out there a long time ago, but apparently it's back. During the pandemic, people were shut in. Not everybody was shut in. Somebody was tiptoeing outside the house. But this is where we are, and this is what we got. So we got to talk about it because it's happening every single day.
Yes, we do. We do have to speak about it. And, the only way you can get information on it is to speak about it, one, and then, the research that she's done to give you information about it is what helps. That's what, educating us on those issues is what's important. That's the most important thing. So let's get into it, because there's so much going on outside of high blood pressure, diabetes, cancer, obesity. Yes, this is a health issue as well. This is a problem too.
Yes, it is.
And we got to speak about it. And that's why we chose this topic, or it's actually given to one of our senior business partners, Mrs. Candida Moses, executive president, asked Victoria she would do that for. And here it is, the report. And it was, when she started getting into it, it was alarming to her. And again, like she stated, it's something we used to talk about years ago. And it's been out of the limelight, but now it's working its way right back into it again. And it's
Share it out,
rising.
family. Share it
All
out.
right, it
This is
really
something we
is.
got
So
to
it's something
talk
we definitely
about.
got to talk about. Absolutely. So with that, our topic is always serving God with healthy mind, body, and spirit. And our scripture, beloved, I wish above all things that thou may prosper and be in health, even as thy soul prospereth. That's 3 John 1 and 2. Our subject, as you can see, syphilis. So who do you know that may be going through that right now? Well, this is the information you're going to get. So take some copious notes because you never know who you may be able to help with information going to be given to you tonight on this prime time segment of Awareness Wednesday. Okay. So with that being said, I'm going to pass it back over to our urgent, the certified health coach, the one who did all the information for you to give to all of us. We can educate ourselves while we're out in the marketplace. We know what we're talking about. And like she always states, she didn't just get this from one source. She gets it from multiple sources. And even during the day, she was doing more research. Even after
I was.
the segment this morning,
I
doing more
was.
research. That's just her. She is a
I
true
was.
urchin. Once she gets hold of something like a
I gotta
pit
know.
bull,
I gotta
she
know
got
the
to know
source.
everything.
Where's
She
this
gets to
stuff coming
everything.
from?
And that's the reason why, this platform is so effective. So Victoria, take it away. The floor is yours.
I thank you, thank you, thank you. And I
You're
haven't
welcome.
done this one before.
First
And this
time
is just one sexually transmitted disease.
out of
This
many.
syphilis is a transmitted disease, and there are many out there, and they are all on the rise, family. So somebody out there bumping and grinding, trust and believe, okay? So this is why somebody asked me to do this one, like Reggie was saying. Miss Candy asked me to pull this up. She said she went to a program on the call this morning. She shared with us. She went to a program, and she was talking to a young lady who was pregnant, and she thought it was a convention, or just something getting to get the young ladies together to talk about pregnancy. And actually, it was something like a class on pregnant women with syphilis, and just being curious, what is that, what's going on, and you want to know. So she asked me to look this up, and I jumped right on it. Last Wednesday we did, what did we do, arthritis?
Arthritis
Right
conference,
after
yeah.
the call, I was already doing research on syphilis. Now I have a lot of medical books in my office, a lot of medical books. This is not covered in any of my medical books that I have on health and wellness in my library. So I really had to do some digging to pull up this information. So here we go, family. Hold on to your belts.
Your belt, the
I
bootstraps.
mean, really hold on to your belts. Okay, it says that syphilis is a highly contagious sexual transmitted bacterial infection characterized by painless sores on your genital rectum and your mouth. This is for families, mothers and daughters and dads. If you got small children, take them out of the room, because this is not for babies. But if you have teenagers, pull them in the room so they can
let them
hear this,
hear.
because they need to hear this. If you got grandma and grandpa, they sitting in the living room watching Jeopardy, go get them too, because it's high in the elderly community.
Yeah.
So here we are. Like I said, it's a highly contagious sexually transmitted disease. And some of this is coming from the Mayo Clinic. So it says the risk of catching syphilis is higher if you have unprotected sex, if you have sex with more than one partner, or if you live with HIV. The chances of getting syphilis also are higher for men who have sex with other men. There's a lot of that going on, family, because you don't know who's on the DL now, or who's, macho today, and behind closed doors, they dressing up in your clothes. So you just got to keep your eyes open to everything that's out there. So it also states that syphilis spreads from person to person through direct contact with these sores. It can also pass through a baby during pregnancy and childbirth, and sometimes through breastfeeding. So after the infection happens, syphilis bacteria can stay in the body for many years without causing symptoms. Alarming. Again, but the infection can become active again. So without treatment, syphilis can damage your heart, your brain, and other organs. This is deadly. This is a deadly, contagious bacterial infection. So it also states that it can become very threatening. So early stages of syphilis can be cured, sometimes with a single shot of medicine called penicillin. I remember back in the day, they used penicillin. They was taking penicillin for every single thing. So that's why it is key to get a healthcare checkup as soon as you notice any of the symptoms. And also, all pregnant people should get tested for syphilis at their first prenatal checkup. So this is what we have here. It states that the most common way of getting it is by having unprotected sex, vaginally, anal, or oral, untreated without a condom. So with someone infected, you can also get the infection if you come in contact with an ulcer on the penis, vagina, or the anus, the bottom, or inside the mouth. We got some pictures to show you. We'll pull those up in a minute. Other ways of getting the infection include cuts, abrasions, and wounds exposed to the infected sores or infected mother to child to birth. So many ways that you can catch this, and it's contagious, like I said. So highly contagious, the numbers of primary and secondary cases of the most infection stages increased by 14% to more than 35,000 cases, the highest numbers reported since 1991. They're going through the roof, family. Also, it says syphilis has long been known as the great immutator, because it can produce symptoms that resemble the symptoms of other condition in many different parts of your body.
Correct.
You could be misdiagnosed of something else and it was syphilis all the time. That's why I say you got to pay attention to your body. You got to listen to your body all the time. Your body's talking to you all the time. So it also states here, congenital syphilis, pregnant people who have syphilis can pass the disease to their babies. Unborn babies can become infected through the organ that provides nutrients and oxygen to the womb. This is called the placenta. Infection can also happen during birth. The newborns with congenital syphilis might have no symptoms at all as a baby, but without the fast treatment, some babies might get sores, rashes on their skin, fever, a type of discoloring in their skin and their eyes, that's jaundice. It's like a yellowish tint to their eyes. Also, not enough red blood cells. The baby can also be anemic. Swollen spleen, sneezy, stuffy, drippy nose, that's called rhinitis, and also bone changes in the baby. Now, a pregnant mom can also, this can be the cause of miscarriages, premature births, or low birth weights if the mom has syphilis. So it's so many combinations around this whole thing. And Miss Nurse Massey was saying this morning at the hospital, she's retired now, but at the hospital, she said that they would give the ladies that had syphilis, they would give them a C-section. So the baby's risk wouldn't be as high of catching it from the mother going through the canal.
Right.
So that's just something to know. So you cannot spread syphilis this way. You cannot spread it through casual contact. You cannot spread it through using the same toilet. You cannot spread it using the bathtub, clothing, or eating utensils. You cannot spread it that way. You cannot spread it on doorknobs, swimming pools, or hot tubs. You cannot spread syphilis that way. Has to be skin to skin, belly to belly, belly to butt contact. It has to be through contact. So once cured, syphilis doesn't come back on its own, but you can become infected again if you have contact with someone who has it. So if you don't want to get it, stay away from whoever gave it to you, or just stay with your significant other. So it states that men account for more cases with syphilis, vast majority of those cases occurring among gay, bisexual, or other men who have sex with men. Like I was saying before, you got all of these macho guys out there, and we don't know what they do behind closed doors. They could be macho during the day, and then they dressing up at night. Somebody's passing this stuff along. So you got to look at everybody that you come in contact with as if they got it, and you don't want it. Exactly.
Unless you can see it on their skin.
Right. There are some visible signs, but that's like late in the stages. So you really got to check people out.
Period.
Really got to check them out. So it states that COVID-19 pandemic had a pronounced impact on the trends of STDs, surveillance data collected during 2020. Listen to this. All of these are sexually transmitted disease, and all of them skyrocketed during the pandemic.
Of course.
You had chlamydia, gonorrhea, antibiotic resistant gonorrhea. I didn't even know if it was such a thing. It's resistant to gonorrhea. You have syphilis, You have HIV, you have AIDS, you have HPV, you have genital herpes, and you got bacterial vaginitis. You also have crabs. That's another STD that's out there. It's so many things that you could pick up below the belt. That's why I said hang on to your belts, family. Literally hang on to your belts. So it says the infections continue to forge ahead, compromising the nation's health. More than 2.5 million cases of chlamydia, gonorrhea, and syphilis were reported in 2021. 2.5 million reported in 2021.
Wow, that's a big number.
1.6 million cases of chlamydia. 710,000 cases of gonorrhea. Syphilis, it was 176,000 new cases.
Get that 713 in there.
713 new cases in 2021. You had 2,855 cases of syphilis among unborn babies. If you think you might have or come in contact with somebody that has it, get in contact with the CDC. You could call the CDC or your local health department in your state. The CDC number is 1-800-232-4636. That is the Center of Disease Control. If you got anything you want to report, they behind so they could go after them and everybody else that they done slept with, because everybody got to get a shot.
Exactly.
Everybody. So it says the estimate cost for syphilis is $26 million. $26 million. And Pastor Vanessa was saying in Houston, they had a grant funded. They had to take up a grant to get the money up in Houston for sexually transmitted diseases.
Is that incredible or what?
Unheard of. Now, these are the ages. Listen to this. 15 to 24 years old account for half of all these new cases of STDs.
Half of the these are new cases now. Think about
cases of syphilis, gonorrhea,
all those,
chlamydia,
exactly,
herpes, new cases.
And isn't there some kind of vaccine to talk about now on the HPV?
HPV vaccine, Gardasil.
They're directing that towards what? The teenagers.
I don't know if anybody else has noticed. There's a lot of commercials for AIDS on TV. In our area, there's a lot of AIDS commercials. They got a pill, they got a shot, they got something. They're using these commercials here for this reason here. Using my Lviv omega-3 green tea 15 years and more. I know that's right, Miss Nancy. But those are the ages, 15 to 24, or account for half of the new cases.
So you got to pay attention to your children. They don't care where they're going. Exactly.
They just wilding out here.
Exactly what they're doing.
Sharing it among their friends. They don't care.
Groups. I mean, it's just terrible.
It says it's 1 in 5 people in the United States since 2021.
1 in 5.
1 in 5. Listen to this, family. We're talking about syphilis this evening, just syphilis. We're not talking about the gonorrhea and all the other stuff. It says worldwide, more than 5 million new cases of diagnosed each year, with most occurring in the low to middle income countries. During 2021, new cases of all stages in the United States, and there's that number, 176,713 new cases.
And remember,
of syphilis.
Exactly. Remember what it said, 15 to 24, half of that. Imagine that number.
Now that says 15 to 24
years old.
We didn't even talk about the seniors yet.
Not yet. Nope.
We didn't get into the seniors just yet. This is happening among the younger generation, and it's happening the older generations. You got grandma and grandpa that's in these facilities that they don't put their parents in. You got these young girls that's going in there the first of the month. They gearing up. They shaving their legs right now. The first of the month is Friday. They are gearing up. They go into these senior citizen homes and they seduce these men for their money. and the men give it to them. They, somebody's paying them a little attention, get them a little aroused, and they just giving up their money to these young girls. So now the gentlemen that's in these facilities, they going around, they tapping Harriet on the butt in the cafeteria, they touching such and such, and they're passing it around.
Got a gift
you got
for you.
more seniors that have syphilis
What
and
you hear about
gonorrhea.
those numbers?
It's crazy, family. So it says this serious transmitted disease, if left untreated, syphilis can be deadly. Without treatment, it can have some serious health problems. It can cause blindness, heart damage, damage to your nervous system, mental health disorders. We wonder why everybody walking the streets crazy.
It could have that. Who knows? Because it does affect the brain.
Brain damage. If caught early, syphilis is easily curable and it doesn't cause long-term health problems. So if you catch it, you got to get right on it. Get down to your doctor's office and get that penicillin shot and hurry up.
If you're not allergic to it.
Right.
Because there are a lot of people allergic to penicillin.
And if you know who gave it to you, you better drag them down there too.
Sure enough.
So it also says it comes in 4 stages of syphilis. And it doesn't always have to appear in these particular stages. It can go from 1 to 4 or 1 to 3 or 3 to 2. It could go like that. So the first one is primary syphilis. That's 2 to 12 weeks after you're infected. You might get a smooth red sore on your genital area or your anus or your mouth. People getting this in their butt and their mouth. Y'all, there's some nasty folks out there. I'm just saying. You might not even realize that it's there and it can heal on its own. That's primary 1. Secondary syphilis, you have 1 to 6 months later. Rough, bubbly rash in the palm of your hands, the sole of your feet, and it reoccurs like flu-like symptoms. They come and go for months or maybe even years. You wonder why you still got that cough and it's 3 years later. You still coughing that 3 years later. Pay attention, listen to your body always. So during the first 2 stages, syphilis is very contagious. That primary syphilis stage and that secondary syphilis stage, you are contagious. But this is also the time when it can still be easily treated with that penicillin. So if you got any of those symptoms, you need to get to the doctors. Stage 3, it says latent syphilis. This stage comes with no signs and no symptoms. It's already in your body laying dormant, waiting for something to happen. So it says, but it can quietly damage your heart, your bones, your nerves, and your organs. Antibiotics can still cure the infection, but there's no way to repair the bodily damage that syphilis has already caused. Meantime, that it finally comes. So it's already in there. You might cure up the symptoms, but it's still there, it's laying dormant. And the last stage, the late syphilis, this is a serious problem. It can cause brain damage, dementia, mental health disorders, heart disease, nerve damage, seizures, tumors, even vision problems. You can have joint and bone pain. So if you have any of these symptoms at all, ask your doctor about being tested for syphilis and any other sexual transmitted infections. When it comes to syphilis, early detection and treatment is cure. It will make the world of difference. Now that also came from the Cleveland Clinic. You got some information from the Mayo Clinic and you got some from the Cleveland Clinic. So here are some of the symptoms. Some of the symptoms, you can have wart-like sores in your mouth, in your genital area. You can also have hair loss, your hair just falling out, muscle aches, extreme tiredness. So see how it can feel like it can sound like it can be something else. Listen to your body. You can also have a fever, start with a sore throat, tiredness or fatigue, weight loss. You don't know how you're losing this weight and you ain't did nothing. Swollen lymph nodes.
That
Check
could
your
be a
lymph
problem.
nodes. Exactly. In your throat area, in your groin, under your arms.
Armpits.
Check your lymph nodes. Also, firm, painless, non-itchy skin ulcers. You can have a little ulcer on your skin and not know it. Headaches is another one. Enlarged lymph nodes near your groin.
Yes.
So if you go into the bathroom and you feeling a knot down there that wasn't there yesterday or a couple of months ago, go get checked out. Definitely go get checked out. And it states here, did I do all of that? Yes, I did. Yep. Okay. It says to protect yourself. How can you protect yourself from STDs? You can also go get a physical exam, get a blood test. They can examine, they can also do a spinal tap. There is a test for syphilis. It's called the RPR, Rapid Plasma Region Test. That's the stuff I was looking up later. So this is how can I prevent STDs? You definitely want to get the facts. If you got anything, go to Google University and start searching.
Because it's all Googleable.
It's Googleable, like for real. You can definitely Google anything these days. But I'm gonna tell you, if you're looking up anything online, check different sources. If you go to the CDC, you might want to go to the Mayo Clinic or go to the syphilis hotline or syphilis website. You want to check different sites to make sure that everybody's saying the same thing. You don't want to get false information and take it and start running with it. You don't want to do that. You don't want to diagnose yourself and just go crazy with it either. Go to the doctors, ask some questions. If you can't talk to your doctor about anything, you need to find another doctor, period. So you want to get the facts, how these diseases spread, how to protect yourself, and what are the treatment options if you have any of these. So here's how to protect yourself. First one is abstinence. Keep
nothing. Keep yourself. Keep it to yourself.
Keep your pennies on. Abstinence, the most reliable way to avoid infection is not to have sex at all. That's it. No anal sex, no vaginal sex, no oral sex, nothing. Keep to yourself.
Exactly.
The next one is to reduce the number of sex partners. Cut down. You had 10, you might want to chop it all the way down to 3. Stop it. And it says you or your partner need to get tested. Because if your partner has it and they go get that penicillin shot, now you still got it. They come back and sleep with you. Now they got it again. You're just going to keep passing back and forth. If they get penicillin, you got to go get
especially penicillin. If you know you got something going on.
Exactly.
Now, there's so many people out there that don't do anything and they don't care. They're not going to tell nobody. They just want to get that fix and keep moving forward and just keep spreading it over and over and over again. And then
you wonder why you ghosted.
Exactly.
They ain't coming back because they think they got it from you. You might have gave it to them. Or they may have gave it to you. Now they want to ghost you. Don't want to have nothing to do with you. They got what they came for and now they're gone. You got to be careful up in the streets out here. The next one is mutual monogamy. Sexual active with only one person. Your partner, period.
How you doing?
I'm doing just fine. How you doing?
I'm doing really good.
I'm telling you, family, if you're going to get in a relationship, y'all got to make that bond. This is it. This is all you get. What you want me to do? You want me to dress up? You want me to be a nurse? You want me to be a fireman or something? We can role play. We gonna keep this going here.
That's right.
But you got to do what you got to do, family. It's serious. You got to do what you got to do for real. The next one is to use condoms correct and consistently every single time
and
you
don't
lay
fall
with somebody.
For the okie though. I don't like using those. It's not the same feeling, this and that. No, you want some of this, you better use that.
You might have to put a condom on, put a sandwich bag on top of it, and double up on everything. Shoot, I'm just saying,
take no chance like that.
You can't take a chance.
I don't know
with
you
your
that
life.
well.
You just don't understand.
Exactly.
So you want to use your condoms correctly. There are correct ways to put it on. If you don't know, look it up or ask your mama. Right? They'll know that too. Consistently. If you have a latex allergy, now this is another one, ladies. If you got a latex allergy, synthetic non-latex condoms can be used.
Yes, they can.
But It is important to know that these condoms have a higher breakage rate than the latex condoms.
They're not as strong.
That's why I was saying you might put that condom on, might got to put a sandwich bag on top of it. You got to do what you got to do if you really want that piece. But use your condoms, family. Stock up on them. They had to the health department
gives
used to
them
give
away.
them away.
I think they still do.
I don't know.
I
Find
think
your
they still
local
do.
health department and ask
They
for
still
them.
do.
They should be giving them away. They used to give them away in high school. Talk to your children about this issue. Your children are out there, they sleeping around. You don't know what your children are doing. You're not with them 24/7. Just like we said, you got to check with grandma and grandpa at the center. You got to check with your children too. They said 15 to 24.
What was the young lady who mentioned to me that the guy went to her house to give her an intervention?
Oh, that's
how old was she?
She was 9.
9. How many partners did she have?
7.
7. 9 years old.
9 years old
with 7 sexual partners.
This is the prison doctor. I don't know if anybody follow the prison doctor, but he goes around in people's houses and he deals with these issues, unruly children that these parents are just letting run their house. One little boy, he trashed his mother's house because she took his cell phone. I mean, he trashed that, tipped the stove over, knocked over the refrigerator, cracked up the countertop. He just lost his mind because she took his cell phone. Now he went to this woman's house because her young daughter is off the chain. Out of control, twerking, partying, drinking at 9. She had 7 sexual partners at 9. 9. So you know they're getting their menstrual cycle earlier. They're messing around. You can have a 10-year-old that's pregnant. Pay attention to your children. If you got to go in there and kick that door down to see what they're doing in there, get in there and check that out. Or take the door off the hinges. That's your house. You pay the money to be the boss up in there. If your child, what do you say? Bring back the old parents. Bring back these old school parents. Well, we just didn't let them get away with nothing. Yeah, we need more big mamas. These kids are getting away with way too much, and we got to reel them back in. We seriously got to reel them back in. So check on your children. Pay attention to what they're listening to and who they watching. Twerking ain't for everybody. So those are some ways to protect yourself. Abstinence, none at all. Reduce your number of sex partners. Mutual monogamy, that's between you and your partner and just the two of y'all. Use your condoms correctly. There's a correct way of putting it on. Look it up. But like I said, if you are allergic to latex, there are some non-latex condoms out there, but they're higher breakage rates. So be careful with that. So to put yourself to the test, get tested. Get tested for any STDs when you go to the doctors. Don't forget to tell your partner to get tested as well. There's a test out there, it's called the RPR test. You get the results back in 3 days. They were saying on the website it's $49. I don't know if you have to send off for it, but you can look it up. If you're suffering from syphilis, go to the syphilis website, look for the RPR test. It's the rapid plasma region test. You can have results back in 1 to 3 days. Many STDs can be easily diagnosed and treated. If either of you or your partner is infected, both of you need to receive treatment at the same time to avoid getting reinfected. Got to pay attention to that, family. So now I just want to share with you some stats. I had to look this up later. This came after the report I did today.
If you don't mind, before we go into the stats, I just want to read you guys something.
Share that.
All right. Some of you might remember, in fact, I mentioned it on the call this morning in reference to what was done to a lot of World War II veterans back in the 1940s, 30s, actually mid-30s up until the early 70s. And the Tuskegee Airmen, the Tuskegee soldiers were part of an experiment. And hold on, see if I can pull this up. And what happened, they were given the virus. They were given the syphilis virus to see how it would react in African-American men. Actually, to my point, I think they were trying to wipe out some black men in the first place. But here's what it was. And I thank you, Miss Pastor Vanessa Witherspoon. You know, you guys have heard her. She's a historian. And she heard me mention this. And she sent me a text. The Tuskegee study of untreated syphilis in the Negro male was a study conducted between 1932 and 1972 by the United States Public Health Service and Centers of Disease Control and Prevention on group of nearly 400 African American men with syphilis that they were given, literally given the virus, given to them. So that lets you know.
Was that an experiment? Was that done on purpose to see
knows?
What was that going to?
Why was it all African American men? You got to think about it.
Got to pay attention, family.
And here it is. A lot of them didn't know what was going to be the outcome of that. So a lot of them went home to their significant others and having sexual relations with their wives and their partners, not knowing this was going to be happening. So now you see what I'm talking about. But that's what was an experiment on Black men back then. So think about it.
So the numbers are on the rise. They are truly, truly on the rise. And this is a thing I pulled up this morning. This is by the states. It's on the rise everywhere, but it is truly, truly off the charts in South Dakota. South Dakota had the highest percentage, 103%. New Mexico was 97%. This study was done in 2021. 21. Nevada, Las Vegas, Nevada. What stays in Vegas? What happens in Vegas stays in Vegas?
That's what they say.
It ain't happening.
It ain't staying there.
For real. Nevada is 97.5%. Texas, 72.7%. Mississippi, 88.3%. New Jersey, where we are, 36%. New York, 66%. This is 2021 now. District of Columbia, 129%.
That's 130. That's 0.8. That's 130.
130. District of Columbia, they getting down over there. You hear me? You have California, 79%. Arkansas, 79%. Arizona, 87%. Florida, 75%. A lot go on in Florida too. This is 2021. I have to keep re-innovating that because now this is 2023.
Correct.
Even in the Virgin Islands, 40%. It's happening everywhere, family. Over. The numbers are through the roof. Now, also went back and pulled up the top 5 states. This is for this year.
2023.
Center of Disease Control, 2023. Nevada is number 1. Nevada. 24%, well, 25%. Mississippi, 25%. Alaska, where it's cold in Alaska, they snuggling like a mug up in Alaska. 24%. Oklahoma, 24%. And New Mexico, again, 22.3%.
Now, you guys got to think about this. These are the increases.
2023.
From 2021 increased by that number, that percentage. So you got to pay attention because you never, ever know where that's going to take place. I mean, who do you know? It could be anybody. Like you said, 1 in 5, I think it was 1 in 5.
1 in 5.
Think about it. It's all over the place. So who knew that it was this bad? And it's getting worse.
Just put it this way. Somebody passing it around.
Somebody. There's more than one person.
Is it you? What Reggie says, there's a lot of bad people out there, but they move around a lot.
A whole lot.
It's a lot of people out there with syphilis and they're moving around a lot. You got to be extremely careful of who you are dating.
Yes.
Where you meet them from. This online dating stuff. Good luck with y'all with that. But you got to check people out. Your first date should be to the clinic. Let's go get checked out. We're gonna go to dinner and we're going to the doctor's office. Dinner and doctors. You gotta get it in there some kind of way. You cannot be afraid to talk about this because it's spreading. It can lead to blindness, nerve damage.
Let me just show you.
Vision. Oh yeah, show some of the pictures. And let me tell you, back in the day, this was the disease that was taking out mob bosses.
Yeah, Al Capone was one.
Al Capone was one of them. His brain shriveled up in prison. It affected his brain. Al Capone, your big mafia guys was taken down by syphilis. Back in the day, you had all of those big bosses, big mob guys being taken down by syphilis. So pay attention to who you're sleeping with. Pay attention. Have some real good conversation.
Okay.
Here's a secondary picture. This is the second stage of it right here. Reggie's pulling it up on the screen. You might not be able to see it on my phone.
No,
But
they
we got
won't.
it
It's only
on,
on Zoom.
okay, we got it on Zoom.
Give me a minute.
There's some,
Slow
oh, it is
loading.
on my phone. There it is.
Okay.
Okay, you have some hands. This is secondary syphilis now. You got it on your hands. They might have some spots in their hands and the bottom of your feet. You can have some spots and things on the bottom of your feet, these little sores. This is syphilis, family. And it's not an old person's disease. It's back and it's on the rise.
Right.
So you got to pay attention to what's going on. And these are sores just in your hands and your feet. Syphilis starts in your genital area. So what you see here is going to spread to your genital areas. You're going to get it from your genital areas. You're going to get it in your groin. You're going to get it in your anus. You're going to get it in your mouth. Where's the next picture, Reggie? This is a tongue with syphilis in the mouth. I'm telling you, you start dating somebody, you're going to have to go over their body with a flashlight and a magnifying glass. You might have to pour some peroxide on their behind to see if they bubble.
I'm telling you.
You got to do what you got to do to protect yourself in 2023. It's a lot of stuff out here on the market. It's a lot of things in the streets. Nobody wants to be by themselves. The winter is here. People want to cuddle and coddle. I get it. I understand. But we're just saying, be careful.
But here's the thing. The images that I just shared with you are minor compared to some others that were even worse off than what I just shared with you. I mean, much, 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 much worse to those who waited to the last minute and did not do anything and show the results of that. I wasn't going to show you that because it's way, way too graphic, but
I posted something earlier on my page
and it was too graphic. They blurred it out.
It was too graphic. And it was just a foot right. with syphilis on it. So I said, if they blocking the foot because it was graphic, it ain't no telling that get checked out, family. That's all we're saying. This is Awareness Wednesday. We do this platform to keep people aware.
That's it.
I am not a doctor. I don't try to play one, but I am a researcher and I will look something up.
Information is what we do. Give good information.
I get several sources from different places. I don't get it all from one place. I do go to Google University. There's Wikipedia. They got the different websites for all these issues that come up. And then I got every medical book you could probably think of.
And it's all public information. Anybody can get it. So if we can see it, we can read it, we can talk about it.
Exactly. And this is nothing to be ashamed of. If you are ashamed to talk about, you shouldn't be doing nothing no way. You should not be laying with nobody if you can't talk about it. He take his clothes off, put it in my hand, let me look at it. You got to get real serious with what's going on out here. You got to stand there, lift your girls up and do this and do what you got to do if you plan on sleeping with somebody or making that your significant other. This is 2023. We don't want to lose anybody or talk about you. But protect yourself in 2023. If you want to make it to 2024, protect yourself. I always say, listen to your body. Your body is always talking to you. Slightest little bump here, little curve there, little dent there. Pay attention. Your body's talking to you all the time. Give your body the proper nutrition and the proper waste removal. Your bodies can heal themselves. Absolutely. We got to get our bodies in an alkaline state.
And that's the magic.
That's the magic.
The alkaline body is everything. People just don't understand the importance of that, of being alkaline. And that's why we speak about it so diligently about the importance of it, because there's more people who are acidic in this country, more than 90%. That's why we have the highest rates of this: cancer, high blood pressure, diabetes, obesity. And the bodies and immune systems are compromised because of what we're doing to this temple God gave you. You got to treat it like you want to be treated. You got to treat it well, treat it good, put good things in that body to maintain good health. If you want to be healthy and sustain that, you got to put the right things in that temple. Feed it what it needs. Good nutrition, like she stated. Proper nutrition, good waste removal, the body will take care of itself. The body can't heal itself if it doesn't have the good things in it to do so. And it's like a well-oiled machine. God created a great thing here, but we got to take care of it. Remember, I always state this. You are the side effect of what you put in your body. Woo. And if you don't like that, what you see, change it. Change it, reverse it. Anything can be reversed, but you got to be the one to make it happen. So let's go to work and make this happen. We want to live a healthy lifestyle, let's do it. Now, we all have an expiration date. We can't change that. We have no control over that, but you have control over how healthy you can be and be as healthy as you can. Exercise, eat right, Take your good nutritional products like we speak about every week. That's the most important thing. We're not going without our stuff.
Not at
We
all.
gotta represent what we're speaking about, and we're gonna keep doing that so everybody get it.
And we're in a health and wellness company, and I'm gonna say you can take anything that we got to help build your immune system. We got the red Lviv that we drink every single Wednesday.
Absolutely,
We
every
got
Wednesday.
our green Lviv. Red Lviv is high in antioxidants,
and that's the
the
key
more
component.
antioxidants you get in your body is particularly directed to how long you will live.
Exactly.
Antioxidants. I posted on my page today all kind of fruits and all kind of vegetables high in antioxidants. Get this, put some of those in your body daily. Check my page. You're welcome, Miss Christine Carr.
Hey, Miss Christine Carr.
We got our green Lviv, a daily detox. What goes in has to come out, family. If you're sitting in, you're not going to the bathroom for days, you backed up.
You backed up. You got a problem.
It's serious.
That's not normal.
You have our multi plus. It's a multivitamin. We all need a good vitamin daily. We need a good vitamin. Even as we get older, our bodies just don't absorb our nutrients the way we should. So we need to be taking some type of supplement. So we need to take our multivitamin. We have a pure noni. Pure noni is a cell regenerator. Regenerate those cells. It's a pain reliever as well. So you got to get good nutrition in your body. We have another product called Shield. It's winter time. It's an immune booster. It has zinc and ginseng, everything that your body is asking for. Get some good nutritional supplements in your body. We can't live without them, family, because you know they messing with our food.
Exactly. Your body doesn't produce all these different vitamins. Absolutely. So you got to put it in because of these different foods out of here that are no good for us.
Absolutely.
Frankenfood.
That's it.
Generally modified engineered food is not doing us any good whatsoever.
Let's continue. We have our green 29. Indeed. They're nothing but vegetables, 29 different vegetables. You can take it. Comes in a little capsule, 2 with every meal. You get all of your vegetables in there. Your cran aloe. Cran aloe is a diuretic. So if you're taking something and you're not going to the bathroom enough, we got our cran aloe. It's a diuretic. We have our ultra body cleanse. That should be coming to fruition right now because the holidays are over. The leftovers are gone. It's time to poop. It's time to get all of that.
You should have been doing that the day after or the day of.
Then we have our omega-3, our fish oils. You got to get those, keep those joints lubricated, them elbows, those knees. You don't want to crackle and sound like a box of Cracker Jacks when you get out of the bed. So keep those joints lubricated.
Correct.
Then we also have a product called Shanti. It brings balance to your body. It's good to enhance your mood and just mellow you out. We got something for everybody and everything.
And they are so good for the body.
Natural products, no side effects.
None.
They are going to keep you sharp, keep you on your toes. Everybody in the family can take the same product. It's not going to hurt you except for the Ultra Body Cleanse. Kids can't take that. Might be a little strong for their little bellies, but they can take that green Lviv and get flushed out.
Same thing.
But you got to give your body what it's asking for, family. Do we have anything for syphilis? Yes. Keep your immune system strong and stay away from the nasty people. Stay away from the nasty people. Just be mindful of who you bringing into your house. Everybody is not supposed to be in your house. I hope y'all know that. All energy is not good energy.
No. I just want to mention this. We talked about being alkaline and acidic. Again, when your body's acidic, that means your immune system is very weak. It's been compromised. Absolutely. That means your body is susceptible to catching anything, such as infections, diseases, colds. All that can play a role in your health if you're not taking care of it.
Absolutely.
So keep your immune system strong as possible. In fact, I'm going to tell you this. I press upon you to go to the vitamin shoppy or GNC where they sell these pH strips. They cost somewhere around $20. You get 90 strips in a bottle. It's the same ones they use in your doctor's office. Yeah.
I'm gonna get some when I go.
Test yourself. You can get those strips. You can use the one for saliva or for urine or for both.
Same ones they use in the doctor's office.
Exact same ones. Put that tab. You take it in the morning. Put it under your tongue and let it absorb the saliva. And there's 2 pads on there. They're going to change color. On the container, there's a chart that tells you if you're acidic or if you're alkaline. There's a graph there. If you're in the red yellow zone, that means you're acidic. If you're in the red and the blue to purple zone, that means you're alkaline. If you're there, awesome. Stay there and continue whatever you're doing to keep that. Because most people are going to be in that yellow zone, that red zone, because they don't know what they don't know. But that's where you can find out for yourself. Education is everything, so you got to test yourself. Absolutely. Get it for yourself.
So our topic this evening was syphilis. Like I said, it can lead to blindness, heart damage, damage to your nerves, mental health disorder, brain disorders. This is syphilis. It's a serious, contagious bacterial virus that's going around. The numbers are up by 71% since 2021. This is just 2023. How high is it going to get by 2024? The year's not over yet. Be mindful of what you put in your body. Be mindful of who you share your body with. Like Reggie said, this is your temple. Take care of it. I mean, you could go out and they get hair, they get eyelashes, the BBLs, you get
all
everything.
This stuff.
Take care of it. You getting the BBL to go get an infection? I don't think you want that. Just be careful out there, family. That's all we're saying. Awareness Wednesday is here to keep you aware of what is going on. Period. That's all this platform is for. This is the end of November. We are closing out diabetes. This is diabetes month. I will be on another platform at 8 o'clock with corporate talking about diabetes. I'm going to give you the symptoms and signs of diabetes. What not to ignore. Don't ignore the signs. Your body's talking to you all the time. Next month, December, I'm going to give you the rundown for December. The first week, we're going to talk about mental illness. It's the holidays. People are just losing it. Their money is funny. Their change is strange. It's loved ones are not here. Tune in for mental illness. I'll give you all the websites you need to get some information and get some help you need. The second week, we're going to talk about stress. Holidays bring stress. Stress can bring on so many other different issues. We've got to find ways to combat stress, and it's not with alcohol. The third week, we're going to talk about depression. The holidays will bring on depression. Everybody is not happy around the holidays. They're just not.
Absolutely.
You got family members not talking to each other. So depression is going to be for November as well. December. But get on these platforms, learn what you need to learn, pick up these little nuggets so you can make some differences in your life. The last Wednesday of December is just going to be coffee and conversation. We just going to let it all out. Whatever you want to talk about, that's what we're going to talk about. You want me to look up something for 2024? I'm your girl. But that's what December rundown is going to be. I hope to see you there. I hope you to bring back some company with you, because this information, we got to get it out to the masses. We do. The ones that have syphilis are not even on this line that I know of. I'm just breaking this down. We're just saying that the numbers are going through the roof, family. The numbers are going through the roof. We got to pay attention. This is just not syphilis. You got gonorrhea, you got chlamydia, you got herpes. All these other things are on the rise. Talk to your children. Take them headphones out their ear for them to sit down long enough to have a conversation. You could be saving their lives. Also, get them tuned in for all the playbacks we're going to do for December. We got to get this information out, family, and that's what we're here for. So the Flanagans, the power couple of health, we're going to call it a quits for right now. I hope you learned something this evening. The numbers don't lie, period. Numbers don't lie.
This product right here is the one we've been speaking about. That's very, very high in antioxidants. This is key. We are not going a day without our product. This is what is helping a lot of people
every day.
Faithfully. Very high in antioxidants. 5 major superfruits in this product: noni, acai berry, mangosteen, goji, and pomegranate in this product. And it tastes fantastic. And all you take is 2 to 3 ounces, once or twice, even 3 times a day. But we have a program for that. Cover yourself. This is your product.
Cover yourself. You're very welcome, Miss Judith. Very, very welcome. But we are here, family. We're going to just say.
Makes a good Christmas gift, too. See that?
Oh, yeah, I'm doing my baskets tomorrow, so stay tuned. I'm going to wrap and get our product. This is our business. This is what you get. This is the gift that keeps on giving. I'm telling you.
All year long.
You got it. You're a friend of mine. You're real close. You know what you're getting for Christmas. I'm just saying. But I'm do baskets tomorrow. How you can package things up and put them
Yeah.
in baskets and gift wrap them, and how to bubble wrap and blow dry the bubble wrap so it looked like it was store bought. I make some really nice baskets.
Oh yeah.
So that's it, honey. I am
Indeed.
done.
Awesome, awesome, awesome. Great job as always. Awesome information.
Thank you, sir.
Thank you for educating us tonight. Appreciate that.
I educated myself on this one.
All right,
This
I'm
was
telling
an
you.
eye-opener. I was sitting on the edge of my chair.
And you know, we studied this in high school in health class.
Stop looking. I was like, oh my God.
Y'all remember that health class? We had all this stuff in there, but who knew?
Who knew?
Wow, wow, wow. All right. Well, thank you, everybody. You are co-host as always. We surely appreciate you joining us on this platform every Wednesday. You can get some really good positive information.
Live over here. We
thank you for that on Facebook Partners. Hey, everybody. We just really appreciate you guys. You have no idea how much, because you all make it worth it when we do this platform. Because of you.
Stay aware.
All right. So stay aware. Absolutely. So remember, we love you, and there's nothing you can do about it.
How about that?
Cheers. Did you get your antioxidants today? We got ours. Ah, that is so good. I can feel it going to work already.
I'm telling you.
It's going to work. It's going to work. I can feel it. I can feel it. Woo.
Have me up bouncing off the walls. You welcome, Miss Annette Gay. She had great information. It's real, family. We just bringing it to you. It's real. It is real. Carolyn Baldwin is real, girl. Be careful in these streets, y'all. Be careful in these streets. So again,
thank you.
I will be on at 8 o'clock with
8 p.m.
corporate
diabetes.
Talking about diabetes.
Who do you know?
Closing out the month of diabetes.
All right, family.
That's another one not to play with.
Yep. Support it, support it, support it. All right, guys. Have a great rest of your evening. And again, thank you so much for being here for Prime Time. See you next week.
That's another one for the books, Reg.